Dr. Nandi, such a pleasure to welcome you.
Thank you so much for the opportunity. I appreciate it.
You have a fabulous show, and until I came to Detroit, I didn't know how big you were. So, off the bat, a practicing doctor, how does he get the idea of starting a talk show, which has become so popular now?
Well, it started because I always wanted to leave a bigger footprint on the planet than the one that I have. So my wife and I always talked about how to do that. And I initially thought about going to politics. Then it's so dirty that you're always upsetting half the population, right? No matter what you do. So I said, what else could we do? And I was really looking for that. And in one of my talks, we met our executive producer, who said, Dr. Nandi, if you can do what you're doing now in front of this audience to a television show, then it could really do well, and we could really serve the population. So I thought about it. Like most people, we're very busy, and I said, but this is something we can impact people's lives, impact it for the positive. So I said, let's go ahead and pursue it. So we started that about 3.5 years ago, and have never looked back. And the idea is that we want to give people a solution for themselves and their families to live better lives. Very simply put, because we saw there was a real need in television in America and the world for real meaningful stuff. There's a lot of shows, but to really say, this is what's really going on with you, and how can we impact it? And I took it back to say, if you were my patient sitting next to me, how would I talk to you? What kinds of information would be important? And that's how we made the show. Exactly like that. So the show is an hour long. Patient comes in, or somebody with a problem. We talk to them like I would, in a general clinic setting in my office, and then you'd find out what the issue is. And then we have a practitioner who does specifically that, and we talk about some of the ways you diagnose, the new innovations. And then we ask the audience to ask questions that are more pertinent for them than whatever the patient had. So we talk about that with disease states, but we also talk about, for example, how does yoga impact your life? Why should you have organic foods? Why should you as a parent discipline your child, and how to do that? So we take away not just patients who are ill, but how to help the wellness state. And in that, as we evolved, we learned that the market, which we call the television market, is evolving into something that's morphing into the digital market. So we took our show and then added a digital brand to it, and also social media, and that's really been impactful, because now our show is you can see it in any city in the United States, but also in over 90 countries outside the United States. So, and in those countries, we've had a following because of the digital and social media.
So one thing is to have a great passion to serve a cause and be a successful doctor, and media is totally different. The nuts and bolts, you have to have that in you. So did you figure out this before you started, or this was natural for you?
I think that, like everything else, when you start something that's new, there's a learning curve, right? But what you cannot teach is what you said, passion. You have to have something inside that says, I want to do this. And if you do, and you have that desire, you then surround yourself with people who know a lot more than you do, who are smarter than you with knowing how the camera works, how to direct, etc. So you have a team of people. But what I wanted to maintain was that I wanted to be as I am with my patient, meaning that I wanted to be pertinent, I wanted to be real, and I didn't want to cheapen the experience. That's what I wanted to make sure that I added to the whole piece, is that to be able to say, these are the topics I want to cover. For example, I'll give you a situation. We had a producer that we had from Los Angeles who said, well, here's a situation where I'm sure that a child will start crying. Okay, we have to pan the camera and do a close-up. And I said, you know what, this is not what we do. We're not here to take advantage of the child who's having the situation. So small situations like this, but and then over time we learn some of the technical aspects. But the key to me in anything you do, whatever project you try to accomplish, whether it be an entrepreneur or otherwise, find the people who really are suited and gifted to that. I think that especially as a physician, a lot of us think that we are really accomplished and can do anything, which is really not the case. We have to learn, and as anybody else, that you have to find the right people in their expertise to make it well. So, we have a set designer that's, nationally renowned. We have directors and producers that really do a good job. So that's really been very helpful. But the passion to be able to help people, live better lives. When I was 6, I was born in Calcutta, India, and I lived in Bangalore. And I was 6, I almost died of a disease called rheumatic fever. And at that time, the lessons that were taught to me by my parents and my physician, I call them health heroes. They helped me, basically allowed me to live, because of their direction and their leadership is what made me fight this disease and succeed. So I wanted to be able to give that kind of information. My mom made sure that I went to the pediatrician that had the knowledge. But what if you're in a village in somewhere, in the middle of China, or if you're in the depths of Africa, or even the depths of Michigan, where you don't know who to ask? So that's the passion that I had, is that I wanted to create health heroes, people who would be able to advocate for their health care and their families. So that's the passion that drove me to do this. And I was practicing full time. We had a family, but we still found the time to do it because my heart, desire, and passion continued.
You mentioned your reaches about 90 countries across the world. I'm sure some of them are underdeveloped and developing worlds who look for these answers and opportunities to listen to people like you. So here's a dichotomy I see. In the US and other developed world, we spend hundreds of millions of dollars on research to come up with medicines and cures. And the other side, you're saying people are more interested in organic and how to go back to the basic style of living. So there is a huge difference between how it is perceived here and how we're actually going back to the roots.
That's an excellent question. So I call it East meets West, is what I call that. Is that we want to embrace all the advantages that technology brings us in modern medicine. No doubt about it, because it saved lives. In the turn of the century, people didn't live past 50, right? Now, people are living to a longer age. Why? Because of the fact that we have technological advances. So you don't want to abandon those. But you want to embrace the stuff that's been around for thousands of years. Now, in my birth country, yoga was commonplace. Now we're discovering it in the West, and now we're adding scientific evidence. Meditation, transcendental meditation, meditation that's been existing in China and other places for thousands of years are now in fashion. It's not so much that we're going backwards. People think, well, are we going backwards? No, we're just adding to our armamentarium. So I tell, when we do a lot of social media posts so we can pass this information. Facebook Live has been very, very effective for us because we can reach several million people with one post. With one Facebook Live, one post can reach 5 million people. So we can tell them, listen, don't stop taking your cholesterol medication, don't stop taking your high blood pressure medication, but add a little bit of heartfulness meditation. Start that practice because that will allow you to reduce your blood pressure medication. Don't abandon it, but use it as an adjunct. So I think that medicine's evolving because people are realizing that it's not just about the technology, it's about enhancing the technology. And I love this conference in TiECon. We talk about disruption and talking about innovation. I think technology is allowing us to break the barriers of access. So let me clarify. In the world, 400 million people don't have access to care. And so how do we reach them? One of my heroes, or two of my heroes, Bill and Melinda Gates, right? They said, we want to deliver water to certain villages, but we can't have access. Yet, they get Coca-Cola. So why not put water on the Coca-Cola routes so that we can give them water? Using an analogy that's similar, when I went to the townships of South Africa, they are getting electricity with live wires from one tin house to another. Right? They don't have electricity. Running water is scarce. But guess what they do have? A mobile device. A mobile device where they can get their social media, get their Facebook, get their Twitter, right? They can get that. So we can use that just like the Gates did with the Coca-Cola. Use their social media, their smartphone, to be able to access some basic medical care. And a woman from Uganda said that I'm having pain in my right side, I have fevers, every time I eat, within an hour, I'm throwing up, and I don't know what to do. She likely has gallbladder disease and she needs surgery. right? I mean, she gave me some of the questions, but she doesn't even know that that's something that's conceivable. So, you can't do better, and if you don't know better. And so these devices and mobile technologies allowing us to access people to access care in my office. So let's say a patient's coming in and they're waiting for a while to see the patient. Now we have patient portals that you can actually communicate with your healthcare provider. So all of these disruptions, I call them, or innovations, are breaking the barriers for care. And what's more, you can be in your pajamas at home and be communicating with your doctor, because going to a physician's office, going to a hospital, is one of the least favorite things that people do. Right. Do you enjoy going to a doctor's office? Nobody does, right? And there's a reason why, because it's just a unpleasant experience. So technology is allowing us to be able to take away that fear. When I was a child, I was petrified of going to a person like me. My heart rate went up, blood pressure went up, I didn't want to go. And so I think that being able to tell people, let's use these innovations, economically they're very feasible, but what's more important is that we're getting better patient outcomes and breaking barriers to care. And with the show Ask Dr. Nandi, we're able to do some that introduce these people to the healthcare system and then say it's not as foreboding. It's not that we're there to partner with you. So that really drives me.
Yeah. Finally, then, I'm again going back to the underdeveloped world. Healthcare could be accessible. It could be made very cheap and available. There are a lot of generic manufacturers in India who supply through Bill and Melinda Gates Foundation, even the Clinton Foundation. I asked a long time ago, right, in this very room, why does it cost so much, to produce a new drug, and in the range of $1 billion to $2 billion, and they don't like the generic competition. The question I'm trying to ask you is, how do you think, now that you know more than before, to make this accessible and affordable to those populations?
So your question is that how do we get the care to the underserved population? I think it has to do with community. So I think that the next revolution in humankind is not going to be about a gadget. It's not going to be about technology, but it's going to be about spirituality. And what I mean by that is, until we understand that there's a connection between me and you which goes beyond just the physical proximity that we have, we're not going to be able to change those things. So, if you are a prosperous person in somewhere in Oregon, and you see a newscast about a poor boy in Chennai, it's their problem. And people say, well, those people, and there's something's wrong with them, or some unfortunate thing. Until the next revolution, which is happening for millions, that you find a connection between humanity. You say that it's not just their problem, it's our problem. And using spirituality, using meditation, using principles that humanity was based on. We've survived because we had communities. When we were in ancient times, we were being attacked, we lived in tribes. That community, that sense of purpose, helped us to survive. And that has to come back. And it is. It's coming back in younger people and also older people. And once we make that connection, the next revolution, then we will say it's not acceptable. It's not acceptable to have that young boy starve and not have the basic necessities that they need. Once that happens, then the main things you have to do is, number one, get them proper nutrition. Number two, get them water. Number three, make the place that they live clean. If you can do that, you can solve 8 out of 10 of the medical problems that they face. And then everything else goes. So I think, to answer your question simply, it has to do with spirituality. We talk about how society is becoming less and less religious and less spiritual. I think we have to go the other way. It doesn't have to be religious, just spirituality, connecting us as human beings. That is the next revolution. When that happens, then we can solve this. Until that happens, it will be individuals like yourself or me talking to people and say, listen, you know what, let's make it affordable. But then if it's not your problem, if it's not your own community's problem, you think less of it. We'll start to think of the entire planet as one community, and then we can address those problems together.
Well, on the global perspective and a positive note, such a pleasure.
Thank you so much. Pleasure's all mine. Thank you very much.